Kids with cochlear implants since infancy more likely to speak, not sign. Researchers from Ann and Robert H. Lurie Children's Hospital of Chicago present further evidence that deaf children who received cochlear implants implanted electronic hearing device before 12 months of age learn to more rapidly understand spoken language and are more likely to develop spoken language as their exclusive form of communication. In their study, published in Otology and Neurotology, this was true even for children with additional conditions often associated with language delay, such as significantly premature birth. Researchers also showed that implantation surgery and anesthesia were safe in young children, including infants. Our results clearly show that kids who received cochlear implants in infancy make progress more rapidly and are more likely to use spoken language as their sole means of communication, says lead author Stephen Hoff, MD, from Lurie Children's, who is also associate professor at Northwestern University Feinberg School of Medicine. More than 90% of deaf children have hearing parents. Most parents hope that a cochlear implant will enable their child to talk. However, early implantation is not a public policy priority. For this reason, many children are not evaluated for cochlear implantation until they are over age 12 months. Currently, every state has a newborn hearing screening requirement, which has resulted in earlier diagnosis of hearing loss and fitting of hearing aids. However, no public policy promotes early identification of deaf infants whose hearing would be much improved with cochlear implantation in comparison to hearing aids. Cochlear implants are remarkable in that they enable children to hear the high-pitched consonants such as S. These are the sounds that hearing aids cannot make audible to deaf children. The sooner children are able to hear through an implant, the more likely they will understand when others talk, and learn to speak clearly, says senior author Nancy Young, MD, Medical Director of Audiology and Cochlear Implant Programs at Lurie Children's and professor at Northwestern University Feinberg School of Medicine. Infants should be evaluated to determine if cochlear implantation would provide superior hearing. The procedure is safe and the results can be transformative. In the study, researchers reviewed Lurie Children's experience with 219 children who underwent cochlear implantation before they were 3 years old, including a group of 39 children who were implanted when younger than 12 months of age. The mean age at last follow-up was 7.5 years. They found that implanted infants developed word understanding ability 1 year earlier than those implanted as toddlers and were more likely to use spoken language alone to communicate. Children who were implanted after 2 years of age were much less likely to use spoken language exclusively. Drs. Young and Hoff are preparing to lead a multi-center clinical trial on the safety and efficacy of implantation of infants and children receiving a Med-El cochlear implant system. The study, expected to open later in 2019, has the potential to expand Food and Drug Administration (FDA) labeling for cochlear implantation to children as young as age 7 months of age. At present, all cochlear implant systems have approval for use in children 12 months of age and older, based upon FDA clinical trials done several decades ago. However, many implant programs use these devices off-label based on more recent studies indicating superior outcome. Mothers' behavioral corrections tune infants' brain to angry tone, the same brain network that adults use when they hear angry vocalizations is at work in infants as young as 6 months old, an effect that is strongest in infants whose mothers spend the most time controlling their behavior, according to a new study in the open-access journal PLOS One by Chen Zhao of the University of Manchester, UK, and colleagues. The study indicates that the network recruited in adult vocal emotion processing is up and running quite early in life, and that its sensitivity to anger is partly a result of maternal interactions. It has been recognized for generations that infants can distinguish the emotional content of their mother's voices long before they understand words, based on intonation, tone, rhythm, and other elements. In adults, that emotional content is processed in the frontal and temporal lobes. Brain imaging studies in infants have been performed, but the noise of an MRI machine has made analysis of response to sounds challenging. In the current study, the authors overcame that limitation by using functional near-infrared spectroscopy, a silent, non-invasive method that measures blood flow to cortical areas, while infants sat in their mother's laps and listened to recorded non-speech vocalizations that were angry, happy, or neutral in emotionality. Separately, the team also observed the same mother-infant pairs during floor play, quantifying the mother's interactions in terms of both sensitivity to infant behavior as it changed, and directiveness, or the degree to which the mother sought to control the infant's behavior. They found that both angry and happy vocalizations activated the frontocortical network, and the level of activation in response to anger was greater for those infants whose mothers were more directive in their interactions. The results suggest that greater experience with directive caregiving, or the stress it produces, heightens the infant brain's ability to detect and respond to angry vocalizations. Zhao adds, brain science shows that babies' brains are sensitive to different emotional tones they hear in voices. Such tones can cause different activation patterns in the infant's brain areas, which are also known to be involved in processing voices in adults and older children. These patterns also reveal that the early care experienced by babies can influence brain responses, so that the more intrusive and demanding their mother, the stronger the brain response of these 6-month-olds is to hearing angry voices. Infant sleep duration associated with mother's level of education and prenatal depression. A new study analyzing data from Canadian parents has found that babies sleep less at 3 months of age if their mothers do not have a university degree, experienced depression during pregnancy, or had an emergency cesarean section delivery. The study, which examined associations between a mother's level of education, prenatal depression, method of delivery, and her infant's sleep duration, was published this month in Sleep Medicine. It found that infants born to mothers without a university degree slept an average of 13.94 hours per day, 23 minutes less than infants born to mothers with a university degree, and just short of the National Sleep Foundation guidelines of an average of 14 to 17 hours of sleep per day at 3 months of age. The researchers analyzed data from 619 infants and their mothers participating in Allergan's Child Cohort Study, a national birth cohort study collecting a wide range of health, lifestyle, genetic and environmental exposure information from nearly 3,500 children and their families from pregnancy to adolescence. Sleep affects a baby's growth, learning and emotional development, and is one of the most common concerns of new parents, said Piyush Mandhane, an associate professor of pediatrics at the University of Alberta and one of the study's lead authors. While earlier research has linked a mother's socioeconomic status, including level of education, to shorter infant sleep duration, we have not really understood the factors at play. Our study revealed that 30% of the effect of maternal education on infant sleep duration is actually mediated by a mother's prenatal depression, as well as the type of delivery. Specifically, the researchers found mothers without a university degree to be at significantly higher risk of having symptoms of depression during both the prenatal and postnatal periods, or the prenatal period alone, compared to women with a university degree. There are several possible explanations for the association between maternal depression and infant sleep, according to co-lead author Anita Kozersky, also a professor of pediatrics at the U of A. Mothers in distress tend to have sleep problems during pregnancy, which can be transmitted to the fetus via the mother's circadian clock and melatonin levels, she said. Maternal depression and emergency cesarean section also both lead to elevated free cortisol levels, which, in turn, may cause an exaggerated stress response in infants that negatively impacts their sleep. Further, the researchers found that the method of delivery independently predicted infant sleep duration, with infants delivered by emergency cesarean section sleeping approximately 1 hour less per day than infants born by vaginal delivery. This was an interesting finding, as we did not observe an association between shorter infant sleep and scheduled cesarean sections or vaginal deliveries, commented first author Brittany Matenchik, an Allergan trainee and a former master's student at the U of A. While we are still at an early stage of unraveling the underlying biologic mechanisms, our study suggests that prenatal depression and birth mode are potential targets for healthcare professionals and policymakers to improve infant sleep duration. Mothers who experience prenatal depression or an emergency cesarean delivery may benefit from support so that infant sleep problems do not persist into childhood. According to the team, previous studies have shown that sleep has a large impact on infant emotional and behavioral development. It may also affect how they perform cognitively later in life. We need to support moms before the child is born, added Mandhane. And if we can start to promote healthy sleep early on, 3 months of age onward, I think that just is better for families in general. Mandarin Chinese could help us understand how infants learn English. Infants may be more sensitive to non-native speech sounds than previously thought, according to a study published in the Journal of Memory and Language. The findings shed light on the way babies begin to understand language. The study, co-authored by Jessica Hay, an associate professor in the University of Tennessee, Knoxville's Department of Psychology, and Ryan Canestrasi, a PhD student in experimental psychology, looks at how lexical tones can affect an infant's ability to associate words with objects. Lexical tone is the manipulation of a word's pitch contour. Although English words do not make use of pitch contours within words to convey meaning, many languages, such as Mandarin Chinese, Cantonese, and Thai, do. For example, by changing the pitch contour, the Mandarin word ma can mean either mother, horse, hemp, or to scold. What differentiates Hay and Canestrasi's study from others in the field of infant language learning is its focus on these non-English sound structures. Most research on early word learning has focused on what is referred to as intonation languages, where pitch changes are used at the phrase level but not to mark changes in word meaning, Hay said. However, over half of the world's languages use pitch contours to communicate meaning. The researchers based their experiments on a cognitive skill called task switching, the ability to unconsciously shift attention between different tasks. The research involved presenting 14-month-old subjects with two novel objects paired with a novel pseudoword. The babies had English as their primary household language. Once the infant was used to the association between the object label pairs, they underwent two sets of trials. In the same trials, infants were presented with objects along with their correct label. In the switched trials, the labels were reversed. By measuring average attention for both trial types, researchers were able to gauge whether the subjects had truly learned the object label association. It may seem intuitive that the infants would have an easier time discerning between two objects when the labels differ greatly in tone, but this is not always the case. In fact, the researchers found that the babies were able to learn the association between an object and its label more easily when they heard a sound with a high-pitch contour, just as babies that have Chinese as a primary household language would hear. We think it may be the case that English-learning infants are able to learn from the rising pitch contour in our experiment because they hear rising pitch contours in their everyday life, Canestrasi said. In English, rising pitch contours are prevalent in infant-directed speech, and are also often used to solicit attention and to mark questions. The experiments pave the way for a more inclusive approach to understanding how language is learned. In order to be able to generalize what we know about how children learn languages, it is important to study all sorts of different languages, Hay said. By incorporating non-native lexical tones into our studies, we have learned that infants are able to apply what they know about their own language when learning words in a new language. This suggests that infants are motivated to learn language and will use any potentially relevant information available to them.